its hierarchy as well, isn't it? And I think that's something, when I was hospitalised, I felt really, really low. My self-esteem was really low. I mean, I felt I'd committed horrible crimes, so I really felt terrible. And I think then you're brought into this environment where there is this unsaid hierarchy.
Mm-hmm, yeah.
And let's face it, when you're talking to a consultant psychiatrist or someone of that ilk, they're generally very, very intelligent people. And it's quite intimidating to realise that your freedom kind of rests in their hands. And I just found the whole thing... And then also the sort of nurses are sort of slightly subservient to these people.
Highly sometimes.
And I found that really uncomfortable, because it was almost like the elephant in the room that... we're not all equal human beings now, are we? We're really not.
So I think the hierarchy of the doctor is absolutely damaging to the processes that we try to instill.
And I think it brings up the question of what is the role. I think especially with the questions and the discussion we were having a bit earlier, what is the role of the psychiatrist? And if we're changing what the psychiatrist does, or we're changing the training of the psychiatrist. I was thinking about, what do we do in the mainstay of our day? What skills is it expected that we have? And if we change the training, if we add a powerful psychodynamic, for example, component, what do we lose? And what are the expectations of the psychiatrist? Is it acceptable that we have a different type of training, maybe have slightly less of a medical training? Is that acceptable, or how much is our medical knowledge needed? I think it's an important question.
Well, I suppose it's whether the person with the medical training is the most appropriate person to lead the mental health system, or whether they're an element of it, and where people with other skills are actually possibly more important.
But the difficulty is, if you are still the agent of the state, then what you want most is that person is integrated into the care. That care, whether it's something like Recreate Psychiatry, which by the name of it suggests there is something creative going on. Like, personally, as a psychiatrist, I don't want to be stuck just managing medication.
No, absolutely.
And risk. Because I would like to be doing things that actually are more creative than that.
Yes, absolutely.
But I would also think that there would be justification as a psychiatrist, even if your skills are medical and medicines, to be involved in the creative side so that you're integrated and have a better understanding of any given individual who you're trying to treat.
Yes, I agree. What I'm trying to say, I suppose, is that the power relationships in the system and the primacy of the psychiatrist is not helpful. I mean, I think I've said this before, but I've sat in a CPA review meeting with my psychiatrist, and I think I've been through 2 or 3 support workers in the last 10 years. And this CPA is to review progress and look at meds and see how you're doing. And in none of those meetings has the psychiatrist ever asked or facilitated or suggested that the support worker should input into the conversation. Now, the support worker is actually the person I know best, and they know me best. They come to my house, they know what level of tidiness it's in, they know if relatives are getting alarmed or not, they've seen me in states, they've maybe admitted me into hospital, they know what my symptoms are, they know what I say when I'm unwell, but they're not asked. And I've actually had to facilitate the support worker interacting in the conversation. And this is includes one psychiatrist who I really liked, and he was great, but he still had this flaw, this sort of hierarchical flaw, whereas his view was sort of supreme. And that's what it's flattening this. It's about being mutual and working together. That's what I feel.